Today class, let's continue the discussion on the blood disorder. In the previous video, we have introduced two blood deficiency syndrome, blood deficiency and blood collapse. In this video, we're going to continue the discussion on the blood disorder. In the excess syndromes, we're going to introduce three common syndromes: blood stasis, blood cold, and blood heat. So firstly, blood stasis. Blood stasis manifests as the objective circulation of blood. So just in general, this syndrome, the cause of this syndrome, the manifestation of this syndrome is the stagnant blood. So you can see manifestations of stagnant blood, such as the purple complexion, purple spots in the tongue, or purple tongue. So that's from the inspection. From the signs and symptoms, the patient also may present with pain. This pain is a fixed area, and the pain may be worse at night. So that's because blood stasis is an impathogen. The impathogen can aggravate at night, and a fixed position is the characteristics of blood stasis of stagnant blood. Stabbing pain also refers to the stagnant blood. The patient also may present with bleeding. If bleeding, the blood is dark purple, or if this bleeding also can present in ladies, such as the period. The blood in the period is dark red or dark purple, or deep red with clots. So that also indicates blood stasis. We have spots on the tongue. In the tongue inspection, we have shown you some of some photos of this kinds of blood stasis, stagnant blood tongue. The pulse can be hesitant, can be threatening. So these are the common manifestations of the blood stasis. Apart from the manifestations, we also need to study about the cause or the possible causes of the blood stasis syndrome. So what's the possible causes? Firstly, the cause can be trauma. So trauma can cause blood stasis. So that's all very obvious. If the trauma is the injury happens, it's bleeding, and then the patient will have blood stasis. Or falling down and then cause the bruise under the skin. That's also a kind of blood stasis. Any other kinds of reason cause internal bleeding. This also will cause blood stasis. So in this blood stasis, you can simplify it to the blood out of the vein. So our blood supposed to stay in the vein, in the vessels. If the blood comes out of the vessels, then this kind of blood we call stagnant blood. So blood stasis doesn't have to be the one we can see, such as the bruise under the skin. The blood stasis or the stagnant blood refers to any kinds of blood that's not in the vessels. The second possible cause is the qi stagnation. The movement of the blood needs the promotion from the qi. So if we got the qi stagnation in the body, it will also result in blood stasis. The third is the blood heat. Blood heat syndrome we're going to introduce in the next slide. Blood heat or blood coldness. Blood heat. If we got excess heat in the body, especially in the blood, the heat going to concentrate the blood. So the blood will be concentrated, and then it will cause blockage because the concentrated blood will be sticky. That's very similar when you concentrate something while you cook something. After the concentration, it will be sticky. That's very similar in the blood heat condition. Apart from blood heat, the blood cold also can cause blood stasis. The cold condition will slow down the circulation, so the blood cold also can cause blood stasis. The last possible causes can be such as the dampness, the phlegm, or the stones in the body. So these can affect the movements, can adjust the pathway where the blood moves. Oh, sorry, this is the fourth one. There's another last one is the qi deficiency. The qi deficiency can result in there's no force to promote the movement of the blood. So these are the 5 possible causes for a blood stasis. If in a test I ask you, can you please indicate the possible causes of a blood stasis syndrome? You need to write down these 5 different causes. From trauma, from qi stagnation, blood heat or blood coldness, dampness, phlegm, and stones. The last one, qi deficiency. So that's all the possible causes of blood stasis syndrome. Why we need to understand the causes? The reason is because from the treatments, we're going to relieve the causes, such as if the patient's blood stasis is due to qi deficiency. In the treatment, we're going to activate the blood circulation. We're also going to tonify the qi. That's the treating towards the root cause. If the cause of this patient is due to blood heat, we're going to promote the circulation. In the meantime, we're going to relieve the blood heat. We're going to use some acupuncture points or herbal medicine with cold condition can relieve the blood heat. That's why it is very important to understand the causes of the blood of the blood stasis syndrome in individuals. So the key points, the key manifestations of a blood stasis syndrome is stabbing pain. Pain is a kind of stabbing pain in a fixed area, lungs, bleeding, and also from the complexion and the tongue, we can see the spectral colors. Blood stasis also can happen in all kinds of different organs. When in different organs, they have different names, such as the blood stasis in the heart, or the blood stasis in the brain. Blood stasis also can happen in the liver, in the stomach, in the uterus, or in the lower jaw. So these terms we're going to introduce when we study the differentiation. Very importantly, we need to remember that the blood stasis and the qi function when we talk about the blood syndrome or blood disorder, we need to think about the qi disorder as well, because the blood and qi are very closely related to each other. The blood heat. This is a heat syndrome in the blood level. So in this situation, it is actually because of the excessive fire or excessive heat affecting the blood, and the blood is in the interior, and the blood also a kind of so in this situation, it's actually the heat in level, the heat in level, especially in the blood. Firstly, the heat in the blood can cause blood stasis, or it can result in bleeding. So it depends on individuals. You can both. You can either or both. It's blood stasis or bleeding, especially bleeding under the skin or sores, ulcers. That's that's because the heat burns the muscles and then becomes sores. Fever that worse at night. That's because in the heat is in the in level. The in level at night in the evening also in. So in the evening, the enemy will have some backups from the environment, from the night in this situation. So the fight between the anti-pathogenic qi and the in-pathogen will become more severe. That's why the fever will worse at night. The patient may present with thirsty, red face and eyes. These are the heat syndrome. The tongue is deep red. So the key points is the fever, thirsty, the tongue deep red. The patient may present with delirium. These are the key manifestations. When we study the 4 levels differentiation methods in future, you will also understand that those kinds of deep red tongue, normally there will be no coating or less coating. So that's the key points of blood heat. The causes of the blood heat can be from exogenous heat. So in this situation, it's in a very hot condition, such as in summer, or someone go to, or someone that drives a lot, they use the fire a lot. The cause also can be the other pathogens that affect the human body, and then it causes stagnation. It results in a stagnant heat. So stagnation causes the heat, internal heat, and this heat, when it goes to the blood level, it also will result in blood heat. The second reason, it can be the emotion. That's also from qi stagnation. Thirdly, it can be from the diet. If someone eats deep fried food a lot, so this can cause the blood heat. When a patient presents with insomnia or restlessness, or even palpitation, these are the heat affecting the heart. So these are general condition of the heat. When heat affecting the heart, the patient may present with this. So from this situation, from insomnia, from restlessness, you can't identify where the heat how to identify the heat, where they are. It's fever. The fever will be worse at night. Deep red tongue, thirsty. So that's how to differentiate the blood heat, or how to differentiate the heat in the blood level. Blood cold. The blood cold is also a cold syndrome in the blood. So this is similar to the blood heat. The only difference is the cause. One is the heat, one is the coldness. The coldness in the blood can cause stagnation and also can result in blood stasis. In this situation, the patient may present with cold, a kind of cold pain, so the pain will be can be alleviated by warmth. The patient may present with purple tongue, purple lips. So that's because of the blood stasis. The blood coldness can result blood stasis because the coldness will slow down the circulation. In ladies may present with delayed menstruation. Purple period, the blood in the period presents a dark purple color and with clots. The patient also can be aversion to cold, which is cold intolerance. So as you can see here, the blood cold syndrome. Blood cold syndrome can be similar to the blood stasis, but apart from the blood stasis, the patient will present with cold syndrome, such as cold pain. So what kinds of pain in the blood stasis? That's stabbing pain. So the patient can present with cold pain in blood cold. Dysmenorrhea, painful menstruation, cold intolerance. So these are the manifestations of blood cold syndrome. The blood cold syndrome also can happen in different organs and meridians, such as the liver meridians, the uterus, and especially the blood coldness in the uterus. This will result in infertilities. So when we talk about the therapeutics towards the infertilities, we're also going to mention again the blood coldness in the uterus. These are the different symptoms in the blood disorder. Next one, we're going to talk about the fluid disorders. The fluid disorder also can be divided into two categories: deficiency and excess. Although the fluid, when we talk about the excess, it will be different type of fluid. We're going to name them specifically. So it's not like the excess, the blood or qi. We always use the blood and qi. The reason is because the fluid can refer to different types of fluid. So when we talk about the next slides, we're going to talk about the different types of fluid. In deficiency, because it's insufficiency of fluid. Insufficiency of fluid only means that in the body, the body lacks of fluid. So when the body lacks of fluid, you can think about the dryness in the body. Any kinds of dryness in different area, in the mouth, in the nose, the lips, the tongue, in the stool, in the large intestine. The patient also may present with dry, viscous, or long elastic skin, sunken eyes, thirsty. So these are all different manifestations like links to the dryness. So insufficiency of fluid. This is very similar to the dryness in your garden. You will have dry soil similar to the non-elastic skin. Because the skin is very dry, so it is not smooth. So for this situation, this syndrome, the key points is dryness. Scanty urine, also a kind of dryness. What can cause the inefficiency of fluid? So as you can see, when we talk about each symptoms, we always talk about the causes, the possible causes. That's because in the clinics, when you see a patient with dry mouth, dry lips, dry skin, dry stool, or constipation, when you see these manifestations, and then you remember that in my diagnostics, we did study this syndrome, these manifestations, and it belongs to insufficiency of fluid. And then what follows? How do you treat them? How do you prevent them? So you don't only stop on the symptoms. You need to think about the causes, and then from the causes, you can lead us to the treatment. So the insufficiency of fluid, it can be sweating, excessive sweating, vomiting, diarrhea, or high-grade fever, or from burnt. So these are all possible causes that can cause lack of fluid in the body. Sometimes also can be simply that the patient just didn't drink enough. The insufficiency of fluid in different organs also can present with different manifestations. For instance, the insufficiency of fluid in the lung, because the lung dryness, it will cause the cough, this dry cough, the insufficiency of the fluid in the large intestine. The patient can present with dry stool or constipation, also can have fever. So these are different manifestations in different organs. You might already realize that when I mentioned these symptoms in the disease nature, I always mention that in specific organs, it might present with the other symptoms. This is a very important point in this differentiation method, because the differentiation method that we have mentioned is not sufficient to locate where they are. So these differentiation methods, we're going to combine with the Zhangfu differentiation method. So when you study these differentiation methods, you can always think about in which organs it can present with what kinds of manifestation. For the excessive condition, excessive fluid, it can be a phlegm retention, it can be fluid retention, it can be water retention. Sometimes you will say these are all similar. What's the difference? The only difference, the only reason why we have three different terms for these three retentions of fluid is because in Chinese medicine theory, that we separate different fluid in the body according to the property of the fluid of the abnormal fluid. So the phlegm, fluid and water. Phlegm is more sticky. So something sticky we call it phlegm. Something clear, especially something clear in the stomach, in the intestine, or in the chest. We name them water. We name them fluid and some water retention. If the fluid retention stay in the limbs, such as in the legs, in the bladder, in the abdomen, so we call them water retention. So that's the only difference between among these three terms. Phlegm retention. When we talk about the phlegm retention, we also need to revise the characteristics of phlegm. Phlegm can be visible phlegm and also can be the invisible phlegm. The visible phlegm is something we can see, such as the phlegm from the chest. The phlegm we can cough out. The phlegm we can vomit out, such as the sticky stuff from vomiting. So these we call the phlegm. Very typically is from the cough, from the lung. Thus we call the phlegm, especially for the ones very sticky. Phlegm also can be invisible phlegm. Invisible phlegm is something we can't see, but when it presents with different manifestations, we will think about as the phlegm. The reason is because in our theory, in the basic theory, we believe that difficult clinical manifestations are caused by phlegm. So something weird or something very difficult to analyze, then we will think that it is due to phlegm, and then we will use the treatments to clear the phlegm to treat the invisible phlegm. So the key points for phlegm syndrome: cough with profuse phlegm, fullness, nausea. Some of these manifestations you also can see in the other two syndromes, the fluid retention and water retention. The reason is because the phlegm retention and the rest two are all similar, are all kinds of fluid, internal retention of fluids. So these are similar. Fluid retention. The fluid retention refers to fluid retention in the stomach, intestines, chest, pericardium, lung, and surface of the body. So these manifestations, especially so the surface of the body, we more refers to the water retention, such as the edemas, the stomach will cause vomiting, intestines can cause diarrhea, chest also can cause cough. In pericardium, the patient may present with chest tightness, palpitation, that something already affects the heart function. Some of you will ask, previously when we talk about the palpitation, I said that this is the symptoms of the heart. But now, in this situation, fluid retention, we talk about the pericardium, why the patient will present with palpitation as well. So this is only because of the habits. The problem with pericardium and the problem with the heart are very similar. The only reason why we say the fluid retention not in the heart is because we think that the heart is the emperor. The emperor will never be affected by the pathogens. That's why we use pericardium. This kind of theory we have explained in the basic theory. So that's why when you see pericardium, it also refers to the heart. Also have similar manifestation to the heart. Patient also can present with cough, with phlegm. So as you can see, some of the manifestations are similar to the phlegm. The only difference is from the property of the phlegm retention is sticky. The fluid retention is perfumed, so it's not that sticky. Water retention. The water retention mostly refers to the fluid retention in the lungs, especially in the legs or in the hands, just under the skin. Water retention also can be in the abdomen or in the bladder. So this water retention, this water can be the actual water that we can see, such as the patient may present with pitty edema. The edema is one of the most typical manifestations of the water retention. The edema also can be separated into yang edema and yin edema. From the diagnostics, you only need to have a general idea that the edema we can separate into two, yang edema and yin edema. And the yang edema mostly from the top part of the body, from the face, from the eyelid to the entire body. Yin edema is from the lumps directly. The yin edema is mainly associated with the yang deficiency of spleen and kidney. It starts in the lower limbs, below the waist. Also presents with pitty edema. So thus you can just have a general impressions on these edemas. The edema we're going to study in the therapeutics. We're going to talk more in details about the causes and the treatments towards the edema. So for the water retention, the key point is the edema of the lumps. Also can be fullness, distension in the abdomen, enlarged tongue. So the enlarged tongue is the water retention in the body. So these are the fluid disorder